I'm going to present for you the nursing care plan. Nursing care plan, it's very important for the patient since you will start the patient. So if you are starting the nursing care plan, I want to explain how you will do it. The aim of this presentation is I want you to understand that how you will make nursing care plan, to identify different nursing diagnoses. And there is examples in this presentation, so you can follow also. And then you can demonstrate it correctly. And then you can modify from that what is written here in this presentation also. So you can create your own, So also here it can guide you to the accurate way to make it in 7 forms. Okay, there is seven steps. You can follow that one. You know that nursing care plan is very important so that everybody know about the patient, what happened for the plan previously, or something happened to the patient. So, and then what you want to do for that problem or that concern things. For nursing care plan, you know that there is types, okay? The types of nursing care plan is whether the patient is having actual problem, or the patient is in risk, or the patient is having promotion. You want to do for the patient, mostly this is the trick that we are following, okay? But maybe some patient that he's having chronic pain like sickle cell, or patient arthritis, or chronic pain, so that you can use this syndrome also. The way to write it is like this one, what I am saying here. You can see that the patient is having ineffective breathing, patterns related to disease in the lung, or related to something that you can see, and then evidence by some symptoms. So this is the way for the focus. The risk, it will be something that risk for something like ineffective airway clearance, evidenced by some symptoms, okay, like accumulation of the secretions or something like that. In the promotions, directly you write what you want to promote. The patient coping with his disease, for example, then evidenced by the patient he's verbalized of asking, or verbalized he wants to understand, or to get information, whatever evidence you need. But the evidence, you understand that it is something you can see and you can verbalize, the patient he can verbalize, or you can see it in the report also. Okay, then here is the example. You can see the example for how to write the nursing diagnosis. So I want from all of you to understand that this is the 7 steps you will follow here, starting from the assessment and the diagnosis. If you write diagnosis, there is related to, because diagnosis for related for what, and then evidence, and then the goal, time, implementation, and then outcome. You can see this is the 7 points that you can collected. Then you put it into your nursing care plan there in the 2nd page, in the daily reassessment. And then also, if you are doing your initial nursing care plan, which is with the physician, there is a specific part for the nursing there. After the doctor's plan, you can write your nursing plan, because there is a special place for you to write nursing care plan there in the physician form, okay, of the plan. So I'm focusing how to write it, whether it will be in daily reassessment in the 2nd page, or it will be into that form which is with the doctor. So when you are writing the nursing care plan, you put in your mind, this is the 7 steps that you will follow. Okay, so this is the 7 steps that you will do it. As I said, it is starting from the assessment, and it will have until the evaluation. Okay, so this is very important to do it like this way. And then, yes, okay, so because to facilitate the things for you, I want you to know, there's some examples, I kept it for you, but let me to explain this part, because here is written as an assessment. Here you can see the patient is having severe abdominal pain, and then this pain is having you see, you can write the same assessment as the diagnosis. After you practice this part, you can understand that even the nursing diagnosis, it can be from the assessment or the same. It can be the same. Okay, so write, or sometimes different, because you are writing some problems, then you are diagnosing from that one. Because you are saying fever, then you diagnose you are saying in the assessment temperature is high, then after that diagnosis is fever. So accordingly in this assessment and then nursing diagnosis, because it is modified according to the patient condition. But here you can see in the diagnosis, acute abdominal pain is the same. But here I wrote for you the score. It is 8 out of 10. And related to what? Related to ascites, okay? It is related to ascites. It's very important to know that it is related to what? The nursing diagnosis is related to what? Directly you will write this part. Then evidenced by abdominal distension, okay? Evidence is something that like symptoms or what we are saying, report, or like something you can see in the patient, or signs that you can detect it from the patient, or something the patient he will tell it to us. So we can write it as an evidence, because evidence is the proof that you've seen. That's why you started what? The nursing care plan. Okay, like the patient, he seen something. He said for you something that he is vomiting. So evidence by vomiting, or evidence by something that already he said it, or you seen it, or report. So this is the evidence. Then after that you go to the goal. What do you want for this assessment? What do you want from this acute pain? You want to decrease the pain, isn't it? So you want to decrease it within the target. Why I put the target? Because already this is a pain. Since we are saying, okay, dears, just focus. Since we are saying that it is like pain, or neurological assessment, or skin, or something like need tool. So you understand this part is having what? Having a score. So you want to decrease that score. Clear? You want to decrease that score. And then after the goal you want to decrease, after that one, the time bounds within what? 30 minutes, for example, because you will give a painkiller is like morphine, for example, according to the doctor's order. Okay, so it will be 30 minutes, so the patient will decrease the pain. Implementation is the activity. You will do it for the patient. You will go to take the investigate. You will go to get, for example, to assess the patient to score. Then after that, you will go for giving an administration of medications. Then after that, you know that you want the patient to be in comfortable position, something that you want to do it, because even maybe you will send the patient to dialysis, peritoneal dialysis, or you will call the doctor for doing that one. So what intervention you will do, you write it like this way. And then the outcome, either you will write it is the goal met or not met, or you will write the goal, it is the goal, isn't it? So the goal met or not met. Sometimes we are saying like that way, or you will go into that goal itself, and then you will say in that goal what? The goal is to decrease, isn't it? The goal is to decrease. So maybe you can write what? The pain is decreased. Verbalize decrease. Okay, clear. So the patient, he said decreased. Okay, or verbalize, that is the pain decreased. So meaning you will write the goal is met. The goal either met or not met. Okay, or you can write the goal itself. What is the statement there? You can write what happened to that statement. Okay, that is the meaning of the example here. I hope that it is clear for you. So now let me to show you regarding the examples that we are having for our cases according to King Fahd Specialist Hospital and our hospital. So there is a special nursing care plan, and then I already make examples here for you in 2 slides, slide number 9 and slide number 10, and you can see that the patient, for example, he is having knowledge deficit, neurological assessment, neurological alternation, whether the patient is having knowledge deficit or neurological alternation, cardiovascular problems, or the patient is having respiratory status first or something with the respiratory, you want to do nursing care plan, isn't it? So the nursing care plan is for the knowledge, for the neurological alternation, or for cardiovascular, respiratory alternations, or you want to do for the patient altered the neurovascular function, or the patient is having problem with the sensation, gastrointestinal problem, or diarrhea, or nutritional problem. Here is the patient if he's having low intake or above the requirement he's getting. So it is like this way. Or the patient having urinary problem in elimination, or there is a problem in nephro or eliminations of the urine, or patient is having psychiatric or alternation in psychological function, or an anxiety or something like that. So sometimes the patient is having for the comfort or an anxiety or pain. So the patient maybe will get increase of risk of infection, or risk for infections. Here is skin integrity, maybe alternation due to pressure ulcer, due to bed, he's already in the bed. So many reasons that's why it's collected in this format. We have it in this slide, and we have it we have it in this slide, and we have it in the second slide also. Here this slide, and this is the second slide. As you can see, if the patient needs for the safety, alternation of the patient activity, or the patient is having mobility alternation, you see alternation in the activity and daily and self-care. Here alternation in the mobility and the strength, because there is strength, there is weakness here, but this is in the daily activity general. Okay, also if you can see here for the patient who's planned for discharge, you want to do awareness and education, or health management, for generally health management, or something special for the patient who has a chronic ingestion problem, for the gastric, or the patient you want to hydrate him. Okay, also we have here other nursing completing, because I said we have 2 slides. Also impaired urinary function, constipation or insomnia, the patient he cannot sleep, impaired physical mobility due to something. So you can select, because some statement is nearby, but there is different statement there. Nursing confusion, maybe the patient is having acute confusion or cognitive problem, or patient is having very sad or very depressed, you want to care for him. So grieving nursing or caregiver rule sustain, or maybe you want to give because patient he's having disturbed body image, and then hopeless feeling hope, like self-concept, he's feeling no need to live, or something like that, hopelessness. So the patient may be having altered verbal communication due to so many problems. So you can write here, there is so many examples, it will help you. You can go through this example, and then you can see the examples. It will be down ahead, so you can see all the examples. And then we have also risk for violence, or the patient may harm himself or to others. Okay, so this is also very important for the medical patient. Maybe he is agitated, so you can use it. Also, the patient is risk for bleeding, or patient is having decision conflict, he cannot decide, and there is some problems with his family or his doctor, and he don't like, or something like that. So it's very important to use this type of nursing diagnosis. So mostly these 2 slides, which is 9 and 10, you can see it's very important to you that you can go through, but I simplify for that, so that you can go through that one. It will be in your computer, in your station, all this presentation, it will be there. So you just go through that one, it will be easy. For example, you want cardiovascular, or you want respiratory, for example. So directly if you will press this one, it will come for you. But as you can see, I have some problem here, so I cannot press it. but actually if you press it, it will go into the slide itself, so you can see the slide itself, what is there. So there's examples here like respiratory, as I told you. So this is the nursing diagnosis, assessment, and then it's already numerated also, okay? So you can numerate, it's already numerated, and then you can see the nursing diagnosis, and you can see that respiratory status is the actual problem related to bronchial asthma, for example, or something like that. Very important to write this part. And also evidence by what? Something, symptoms you can see, or verbalize something that he can see, he can tell it to you. The goal, what you want to do for the patient, because you want to give an oxygen, you want to maintain the oxygenation, you want to increase the saturation maybe. So according to your aim, what you want to increase the saturation, you want to get to maintain adequate oxygenation and increase the awareness of needs. So you write the time, very important, the time, within 20 minutes or within 30 minutes or within 1 hour. Then the implementation, what you will do for the patient so that what you want to maintain this oxygen. Then the outcome, you can write the goal is met or not met, or which time it's met. And then maybe you don't want to write goal met, you can write the goal itself, it's already maintained, so you can write the goal is maintained, okay? Maintained adequate oxygenation, okay? You can write whether the goal itself, or you can write that is achieved, or you can write the goal is met, okay? So this is mostly about this part. There is another example, as I told you. You can press this one, anyone, and then it will go. But recently, as you can see, it's not going there. But let me to show it to you in somewhere like here. So in this part, maybe it will be helpful for you because it's actually in your presentation. Something is dropped. Okay, so for example, maybe this one is clear. So if you want cardiovascular, it will go for the cardiovascular. Here is the cardiovascular. If you want, you want a risk for, you want, for example, the patient, let me to start from these slides. You want altered patient pain or discomfort. So directly you can see it came for you that the patient is altered in the comfort, okay? Directly will come for you. It's in your computer, it will be very easy. So you can see how it is worked, and then you can modify the things according to your patient. But very important to do what, to follow this steps here is very important, okay, dears? You can go back again. You can go back to the main, how to utilize this one. Okay, no problem. Let me go up. I'll show you again. For example, you want to see from this one, insomnia, patient he cannot sleep, or the patient plan for discharge. You are happy about this one, I think. So you can click this one. Because I pressed this part. So maybe, okay. So you can press, then it will come. The patient is having what? The patient plan for discharge, okay. Maybe you want, so you can see plan for discharge. So the same component, the diagnosis, here you can see the assessment, diagnosis, evidence, the goal, and the time. You have to write your time. Is it minutes or hours? And then the final, okay, outcome. What is the outcome? Whether you write the goal is facilitated the process of discharge within this time, or you want to write the goal is met or not met. Okay, you can go through any of these two slides, which is 9 and 10, any nursing diagnosis that is suited for your patient, and you can use it. For example, there is a conflict between the patient and the doctors in the decision. You can go for 31. Let me to remove it. Then you go to 31. then you can see the decisional conflict. Then you can write the same what is written here, like in the assessment. You see the patient is confused. You can write another statement even. What other statement you are feeling about the patient in your assessment. And then the nursing diagnosis, it is decisional conflict. Then you write your evidence, what you see in there. If the patient is asking, verbalizing anger, and he cannot tolerate, and he's afraid, maybe from the surgery and something like that, or afraid from the dye or something, or the complication. So you just write what evidence that you can see in this decision conflict, or the patient, he's worried, he don't want to go for OR. And then he's conflict with his family and conflicting with his doctor. And then the goal, what you want to do, to identify the process that to feeling and express, let the patient to express his feeling, let him to be able. You want to make him able to identify and express the feeling in an appropriate manner without inflicting harm to himself or to others, okay, or to somebody. So that is one you wanted within how many? 10 minutes, 20 minutes, whatever. Then after that, what you will do to assure the patient, you just tell, you will bring the social worker, you want the nurse advocate, whatever things you will do. And then after that, the outcome, what you see is that the patient able to identify and express his feeling, and then it's okay. Is that patient is calm, quiet, and it's okay. So you can write the goal and then the outcome. Okay, so mainly it is like this way. Nursing diagnosis, I simplify it for you to be in simple way. It will be easy to check you what you need, and then you can modify. No need to take it all, but you can write some. So it will be easy for you if you get some. For example, you want this one. So, okay, fine for you. But you can remove from the others. Actually, this is all actual problems. Don't write the potential problems unless it is as the second priority. Because the first priority for you is the actual problem. Okay? Then you can write it is the same way. As I told you, it is very easy, and hope that it is enjoying presentation for you, and it will be simplified for each computer. It will be there set for you, and thank you.